Our next guest is going to be talking about dementia, which is diagnosed every 4 seconds and is the number one most modifiable, and I'm sorry, what the number one most modifiable risk factor for prevention is. Please put your hands together and help me in welcoming Dr. Keith Darrow to talk more.
Thank you. Can everybody hear me okay? All right, good. So, I ask that because what I want to speak to you about today is the influence of hearing and hearing loss on the brain. So let me just get something out of the way. Hearing loss is a progressive degenerative disorder. As we get older, the neural connections from ear to brain break down, okay? So we have that sort of fact out of the way. Let's put that to the side. And perhaps it's perfect that the panel was just speaking to you about dementia, and they highlighted the fact that as of today, in 2019, unfortunately there are zero treatments available for patients living with dementia. Now, some may say, well, aren't there those pills that help to prolong memory? And yes, there are. And that's what they do. They prolong memory. But they're not actually treating the problem. And the sad truth is that every 3 to 4 seconds, another patient is diagnosed with dementia. And so given my background as a neuroscientist, as a clinical audiologist, and in the last few years, I've been certified by the American Brain Council as a dementia prevention educator. So given all of this information and my day-to-day interactions with patients, I've come to understand how hearing loss significantly increases the risk of developing dementia. And I would bet that of all the people here, probably everybody in here can raise their hand and say they know somebody who has hearing loss. They know somebody who is suffering with the mind-robbing disease of dementia. And that, sorry, I just want to, there we go. Oops, sorry. That was the motivation behind writing a book. And you're all welcome to get a copy of it whenever I speak. You can go to hearingandbraincenters.com to receive a copy of this book in which I detail the connections of hearing loss and dementia, the connections of tinnitus or tinnitus, ringing in the ears, and dementia, and how that all comes together. And I'm very proud of this book because within 30 days, it rose to become an Amazon.com bestseller. And I don't believe that's because of me and the way that I wrote the book. I believe it's because there are 50 million people who live with hearing loss. There are millions and millions of people that live with dementia or care for a loved one with dementia. And so that was the intent of this book. So I want to start, and I'm excited that the panel mentioned Dr. Bredesen. So he wrote the book, The End of Alzheimer's, which is an amazing read for anybody, even if you're not in the field studying it. But when you open the book, on page 1 is this quote. And this quote is really very powerful, assuming I can get it to come up. There it is. Everyone knows someone who is a cancer survivor. But no one knows an Alzheimer's survivor. I still remember the night I read this quote. That was all I could read. After I finished this 2 sentences, 1 sentence, I had to close the book because it hit me like a ton of bricks. It reminded me of my grandmother who died of dementia. And to add to some of the statistics that the panel spoke about, dementia costs the average family $57,000 a year to care for a loved one. That a person who's diagnosed with dementia, on average, lives for 10 years physically beyond their cognitive capabilities. So it's a very scary, mind-robbing disease that essentially, for the vast majority of patients in the current healthcare system now, when diagnosed with Alzheimer's or dementia, it is essentially a death sentence, which is what makes it so scary. Now, dementia is an umbrella term. Dementia is a generic term used to describe a decline in mental ability. And yes, there are several types of dementia. The household name, the one we all know, is Alzheimer's, as that impacts nearly 50 to 70% of people with dementia. And then vascular. So for all you people out there, if you or a loved one has any cardiovascular disease, you are at an increased risk of developing dementia. And then there's Lewy body, which is associated with Parkinson's. Frontotemporal, and there's actually several other types of dementia that just were kind of too small to fit on the screen. But there are a multitude of types. Now, if you open a textbook, you'll see that the definition of dementia is a decline in mental ability that is severe enough to interfere with daily life. It gets in the way. And you know, each one of us, so everybody here today, has 5 core cognitive functions. And they're listed right up there. And it ranges from memory, communication and language, ability to focus and pay attention, reasoning and judgment, and visual perception, or that could say visual impairment. Now, I want to review with you because now I want to start to go back to, well, how does hearing and dementia, how are they related to each other? Well, just think about it. If I shut my microphone off and you can't hear me, do you think you would remember everything I said today? No, of course not. If you're not capable of hearing what your loved ones, what your family, what your friends, what your coworkers are saying to you, you can't remember it. So hearing is intimately tied in with memory. Now, communication and language. You know that hearing, the ability to converse with somebody, 50% of that equation is based on your ability to hear. And so hearing loss gets in the way of communicating with others, developing language, maintaining relationships. Now, how about focus and pay attention? One of the most common complaints, actually, I would say the most common complaint of people with hearing loss is that they have difficulty paying attention and focusing in background noise. So for all the people out there, if 5 of the tables started to all talk to each other and make noise, the rest of you would have difficulty following exactly what I'm saying. Now with hearing loss, it would be extremely difficult, nearly impossible. So focusing and paying attention becomes a task. It becomes a hardship for people that live with hearing loss. So hearing gets in the way, or I should say hearing loss gets in the way of the top 3 core cognitive functions. And then there's reasoning and judgment. Now, visual impairment. I look out at the room and probably half of you have glasses on. The simple question is, why do you have glasses? Well, the simple answer is because you can't see well. Did you realize that not treating your visual impairment increases your risk of developing dementia? Well, it does. But that's not why you went and got glasses. Living with untreated hearing loss increases your risk of developing dementia. And that statistic, or that now accepted fact in medical science, is based on the reports that have come out over just the last 8 years. There are now 26 reports as of today from labs, independent labs across the globe, confirming the correlation of hearing loss and dementia. Now I have the first three, just 3 of the 26, the first 3 articles that came out. I have them listed right up there for you. Now the first one, you've probably heard of the Baltimore Longitudinal Study of Aging, in which a number of scientists at Johns Hopkins studied aging. They wanted to understand what happens to us, all of us, as we get older. What happens to our feet, what happens to our hair, what happens to our heart, everything. And the most influential finding from this report that made it everywhere, from the New York Times to the Today Show to PBS, it's been everywhere. The most interesting finding was that the risk of cognitive decline and dementia increases by as much as 200 to 500% with untreated hearing loss. It blew everybody away. It turned hearing healthcare upside down overnight because it gave us a new perspective that hearing care is directly related to healthy cognitive brain function. And you know, that book I showed you before, I have a chapter that's titled "A Mild Hearing Loss is a Major Problem." Why do I say that? Because even with a mild hearing loss, your risk of developing cognitive decline and dementia has increased by 200% with a mild hearing loss. So yes, hearing loss, like many major medical conditions, the most important thing that you can do is to catch it early and treat it early. We want to make sure that people get in, that they don't wait too long. You know, the average person waits about 7 years to get their hearing tested. We are on a push at the hearing and brain centers, all the organizations that I work with, to get people in sooner, to get the word out. And so I beg of you, when you're working with your patients, with your colleagues, even your family and friends, encourage them at the first signs of hearing loss, which are tinnitus, or ringing in the ears, difficulty understanding others. Go in and get your hearing tested because of this chart, because of the data that we now know. Now I would ask you, and go ahead, you can just shout out, what do you think the #1 cause of hearing loss is? Any guesses? Okay, age. You nailed it right on the first try. See, a lot of people will yell out noise. And noise is certainly a reason for hearing loss. So too many loud concerts, too many, maybe around construction or working at a factory. But the truth is the #1 cause is actually aging. And unfortunately, the vast majority of us are genetically predisposed to age-related hearing loss. So there's really nothing we can do about it. It's going to happen. It is essentially a fact of life for nearly every mammal on this planet. So we often encourage people, and I know the American Medical Association has considered recommending that everybody get their first hearing test around the age of 50. Now, what actually happens with hearing loss, right? So I ask people all the time, define hearing loss. And they'll tell you it's isolating, it's sad, they can't communicate with others, they don't understand, and all of that is true from a symptom-based approach. But from an anatomical view, what I studied in the labs at Harvard Medical School for over a decade was what's the actual pathology that's happening with hearing loss. So on this screen, right on the left side, you see an image of an ear. And on the right side, you see an image of the brain, okay? And in between, I have 6 bright, vibrant arrows that represent the millions of neural connections that are made from ear all the way up to brain, okay? Now, I want to show you, this is my best attempt at visualizing what actually physically happens with hearing loss. You see the difference? Right? Let me go back for you, okay? Here's the normal ear-to-brain connections. here's what happens with hearing loss for people as they get older. You see, there's a quantitative and a qualitative reduction in the connections from ear to brain. Now, we can't regrow the missing ones. Science isn't there yet. But what's important, the goal of treating hearing loss is to make sure that those nerves that are still there, while they may not be as bright, to make sure that they survive. You've all heard of the simple expression, use it or lose it. If we don't use those nerves that sit there and linger, that go untreated, they too will die off. I kind of think of it as the snowball rolling down the hill. And our job as hearing healthcare professionals is to get in front of that snowball that's rolling down the hill to try to slow down the progression of this degenerative disorder. So what are the neural consequences? Or perhaps I should say, what are the consequences of this neural degeneration? What happens to you? What happens to your loved one as these nerves break down? As I mentioned, for most patients, the most common symptom, one of the first things they notice is ringing in the ears. Tinnitus or tinnitus, okay? It's not a coincidence that 50 million Americans live with hearing loss and that 50 million Americans have tinnitus. That's not a coincidence. Those numbers are near exactly the same because tinnitus is one of the first symptoms that happens with hearing loss. So that's number one. Number two, with hearing loss, with this neural degeneration, we have what we call auditory deprivation, right? So now the brain is not being properly stimulated. And to the patient, they lose clarity. You know, patients will say to me all the time, you know, I can hear you, but I don't understand everything you're saying. I feel like I'm missing parts of the words. I feel like I've lost the clarity. Clarity, or the lack of clarity, is what happens as the nerves break down from ear to brain. And can't hear in background noise. I mentioned that. That is really one of the most common issues that many of our patients have. And third, to circle back to hearing loss and dementia, this neural degeneration appears to be increasing the risks of cognitive decline. And so it starts simple enough, word finding issues, name finding issues, short-term memory loss, maybe not remembering what happened yesterday or what you had for lunch a couple of days ago, right? It's pretty mild symptoms, that mild cognitive impairment, that's pretty difficult to detect. Now, why are hearing loss and dementia believed to be correlated? Social isolation, cerebral atrophy, and cognitive overload. These three theories, in my personal opinion, I don't know that we'll ever be able to separate out the three, and that it's probably a combination of all three that is increasing the risk of dementia in people with hearing loss. See, here's some sample articles talking about social isolation. Now, the top one, that's the first article I could find from, I think it was 1983. Talks about hearing impairment and social isolation in the elderly. A newer article on the bottom, the association of hearing impairment and lower levels of physical activity. So what does that tell us? People with hearing loss do less socially and they do less physically, both of which are really bad and increase the risk of developing dementia and cognitive decline. Number two, cerebral atrophy. You've heard before that the brain of an individual with dementia is maybe a bit bigger than a softball. Does that cerebral atrophy seem to happen with hearing loss? And since a picture says 1,000 words, forget the title of the article, look at this picture. Here's an image of an individual with hearing loss on the left side and on the right side, and this is age matched, On the right side is the brain image of somebody with normal hearing. It's pretty obvious you can see a difference. And so the calculations tell us that nearly a 40% reduction in brain volume in the memory, speech, language, and hearing parts of the brain. Now, cognitive overload. Sorry, let me just get to my last one here. Cognitive overload, right? I don't have to read the title for you, but ask somebody who has difficulty with hearing. Ask somebody with hearing loss, what's it like to go to a restaurant? What's it like to try to follow a conversation? And they'll tell you, it's tiring. And my expression that I tell my patients, living with untreated hearing loss is like driving 60 miles an hour in second gear. You're wearing down the engine. You're wearing down the brain. And so treatment is really important to start as early as possible. And that brings me to, what are the goals of treatment? Why are we treating hearing loss? Why is it so important? Now, number one, and this may seem obvious, and there's a lot of research on this. Treating hearing loss improves quality of life. And we see it with our patients typically right on day one. So that's really one of the first reasons it's important to treat your hearing loss. Second, treating hearing loss can improve cognitive function. Yes, there are now reports, and they're very simple, right? You take two groups of subjects, one group with hearing loss and does nothing, take the other group that has hearing loss and starts treatment. Guess what? The group over here that started treatment, and for many of them, it only takes 14 days to notice significant improvements in selective attention, memory recall, and processing speed. Significant improvements in cognitive function just from treating hearing loss. That's how powerful this technology is. And with new treatment technology, we're capable of properly stimulating the brain, reducing the ringing, and providing relief in background noise, which is what many, if not all, of our patients really want, okay? And so just to highlight some of the benefits of the new technology that we use in our practices to treat hearing loss, this technology is 30% better at understanding background noise. We're talking about like noise reduction circuitry, 20% reduced listening effort, so you're not working as hard on the brain, 20% improvement in memory recall. I mean, this is profound, significant improvements just from treating hearing loss. Finally, to bring it back, right? It started with the panel. I was talking about dementia. And the obvious question that all of us in hearing healthcare asked is, if I treat my hearing loss, can I reduce the risk of developing dementia? And all data certainly seems to be pointing in that direction. There has been a study from a group in France, a group at Columbia University, that are all indicating that treating hearing loss may significantly reduce the risk of developing dementia. And I have a quote here for you from Dr. Doraiswamy at Duke University. The benefits of correcting hearing loss, right? So he's comparing treating hearing loss to memory-enhancing drugs. The benefits of treating hearing loss on cognition are twice as large as the benefits from any cognitive-enhancing drugs now on the market. The treatment of hearing loss, should be the first thing we focus on, right? This is the conclusion that we're coming to. We must start treating hearing loss. We must operate on all cylinders. We must stimulate the brain to help reduce the risk. And finally, the Dementia Commission from Europe, published in The Lancet about 1.5 years ago now. They put out a report that found two of the most amazing statistics in dementia prevention and care. One in 3 cases of dementia is considered preventable. That means 35 out of every 100 cases of dementia, perhaps my own grandmother, could have prevented dementia. And the second most important finding where they listed everything that you and I can do to prevent dementia. I mean, they put together a whole list. And some of the obvious ones are on there. Stop smoking, reduce obesity, eat better, be more socially active. But guess what was at the top of the list? The most important thing that you and I can do, the most important thing you can tell your loved ones to do to help prevent dementia, is the early treatment of hearing loss. It's not my words. This comes directly from the commission that indicated that the most modifiable lifestyle factor for preventing dementia is the early treatment of hearing loss. So, my time's about up. I appreciate you paying attention. If you have any questions, I'm here representing the Hearing and Brain Centers of America, where we have treated tens of thousands of patients, and I'm honored with my partner, Jared Breda, to receive one of your top 50 healthcare company awards. And thank you so much for your time and for paying attention.